0.98. But what it comes down to is 96% of all Mass Health patients, have a dentist within 5 miles of where they live. That's a study that was done by Mass Health themselves. Okay, they did a study of the Mass Health patients and why they had not gone to a dentist, and it was 86% of them, or 84%, I'm sorry, who said that they had not gone to a dentist for a reason other than geographical location. The issue is not a lack of providers, okay, but to better connect patients with a dental home. And, Mass Health is actually working on that right now. I think Tracy Chase from Mass Health, they have a website set up to work with, emergency room services and, overall, to try and establish better connection with dentists. Part of the reason when it isn't the right time, they have a regulation expanding the practice of dental assistants. So they developed those in the military. They haven't even given that a chance yet, and now they want to bring in advanced, hygiene. A hygienist goes to school for 2 years, and after high school, and she's out doing cleaning teeth. They want to come up with a program where she goes 4 years of hygiene school, then 2 years of this advanced dental practice thing with a master's degree, which is 6 years. You actually go 8 years to become a dentist. So it's sort of like they're trying to nibble away at what you're doing as a dentist. I mean, you might as well send dental students out to do what they want to do, instead of coming up with an advanced. Plus the fact you need hygienists. A couple of years ago, Stevie can tell you more than anybody, you couldn't hire a hygienist on the North Shore of Boston.
Severe shortage.
Unbelievable.
Severe.
Now, interesting enough, because of the recession, a lot of hygienists have come back into the, the practice of hygiene. But what they're trying to do in establishing this is really expand the scope of what they do. And, they sort of try to say, well, it's going to cost less money to do that, but it's not going to cost less money. Maybe it's going to cost an incrementally smaller amount, because they're only going to go to school 6 years instead of 8 years, which is what we had to do to get, to where we are. But, it becomes inefficient and ineffective. If you had someone else like an expanded duty assistant who's only being trained 2 years out of high school to work directly under a dentist to provide those services, then you're going to have an efficient model, which again is something they haven't even begun to try to implement through the Board of Registration in Dentistry. So, this bill, to pass this, it's sort of like, okay, 6 years, then, a couple years down the line, they're going to have an advanced dental hygiene practitioner who's going to do the same thing dentists can do, except, maybe won't place implants, won't be able to pull teeth.
I think the crux of the issue is they're saying that there's a shortage of care. There's a shortage of access to care. We find from these studies that there's no shortage of access to care. There are dentists there to recreate this whole model, and et cetera, is just not only unnecessary, the timing of it, the model of it doesn't make sense, but I think the most important point is the dentists are there. So to make another job description is unnecessary. You might as well have a dentist that already is a dentist doing your work. And Charlie said this in the big room. In California, the question became, well, who would you rather have do your dental work? If you're seeking dental care, who would you rather have dental work done by? Somebody in a new created thing, or a dentist? So the public might as well get the dentists that are existing now. And I think that's I think it's the most important point on this whole thing. The dentists are there. People have access to dentists if they want.
They also try to sell a program where basically they have a so-called dental nurse in the grade schools, and they sort of follow along and, clean the kids' teeth, place sealants, do fluoride treatments on an ongoing basis, which has worked well, but they don't have any kind of a safety net when they become adults. And interestingly enough, New Zealand has the worst level of adult oral health in the world, even though they have this great program for kids. So they continue to tell, well, look at New Zealand. Well, New Zealand about the 8th grade, and then after that, there's no program in place people are gotten used to free care, so if they suddenly are faced with paying for it, they don't even understand it, you know. So, but the biggest thing is, like, it really isn't the right time for it, you know.
And in a nutshell, let's finish up with the programs that have already been legislated, see how they pan out, whether they have an impact one way positively or negatively on the providing of health care, and go from there. Okay. So the other major thing that we wanted to talk with you about this morning is we're hoping that the legislature will restore mass health funding for adults. And it was eliminated about 5 years ago. And there is going to be money available from the federal government starting January 1 of 2014. And what we're hoping is that the state legislature will deal with that as matching funds, and that to maintain the full funding that the state has allocated already that has been requested, so that the total package will be able to provide the coverage to the adults that they need, so that things that are small now can be taken care of while they're small, rather than having to postpone treatment and make it more costly and more involved for the patient also. So that's what, and we realize there are all different kinds of numbers that have been thrown out as to what constitutes the total budget on it, the total cost, whether it's matching funds or not matching funds. But the thrust of it for us is that we would like to see that the state maintain their funding at the maximum level and use the federal funds as matching funds to supplement that funding.
It's also very cost effective that adults have access to care, because if they don't have a neighborhood dentist to go to, when they have an emergency, they utilize the emergency rooms of the hospitals, which costs a lot more money for ineffective treatment because there are no dentists on staff.
Well, it's like $300 to go into the emergency room, you know, I mean, that's the flat-out fee that they charge. And somebody that goes in with a toothache, they can't treat the dental problem. Somebody has an infection, an abscess of a tooth, they can't take the tooth out, they can't do a root canal. You know, it might not even have become an abscess needing a root canal or an extraction if they'd had a filling 6 months or a year ago. You know, so they're going into the emergency room. They give them an antibiotic, they give them some pain medication, they go home, you know, the infection goes away. 6 months later, because it's a tooth that's still in there, it's like having a splinter in your finger, it gets reinfected, they're back in the emergency room, another $300. You know, there was never any definitive care. So, you know, dental actually represents less than 1% of the total Medicaid budget, okay? So 99% is medical, you know, general medical, 1% is dental. When they're cutting the dental, you know, it's like they're not really doing it in an area that's gonna make a difference, you know?
Yes, hi. We kind of lost you in the shuffle, sorry about
That's
that.
okay,
We
that's
rushed to
okay.
get out.
But even the last one, you know, pregnant women with gum disease have a tendency to, they're 7 times the risk of delivering a low-weight baby. You know, a normal child, you know, normally a child that is born, it's $1,500 to, you know, provide care for that child. For a low-weight baby, you know, by the time they put them on respirators or whatever other care they need, you know, it ends up an average of $75,000 in cost versus what it would have done if indeed they had received care during their pregnancy, you know. So it's like that's another, and you know, pregnancy, you know, during pregnancy, women are more prone to periodontal disease. And many times they don't know that, and they don't, you know, that they don't seek care and end up having these problems.
So it's not a cost savings. The morbidity and even possibly mortality, according to most of the surveys, the medical costs will be much higher than what they would spend in dental. So it's a humane and it's a dollar saving thing to restore.
Stephen, and shows a dental student who's with us.
Thank you.
So, not to take up too much more of your time, but we're going to leave you some. John, which was the typo on which page was that? It was on the
Typo was on the
anesthesia.
Yeah, the anesthesia one was the,
Yeah, it says where it says, it's a paragraph that
Second.
starts unfortunately,
Yeah.
where it says medically unnecessary, the word should be necessary.
yeah, citing the procedures is not medically necessary.
I just wanted to make sure that we...
Too many negatives.
But there are several other aspects here. One is a bill that is sponsored by Senator Cream, which is to fund a study to look at oral sports injuries, which is kind of what we've maintained, a mouth guard bill that we're hoping will substantiate the need for it and give further impetus to that
It's
bill of
basically-
mouth guard being
yeah.
passed.
It's an act to mandate the Department of Public Health investigate and report on the incidence of oral injuries. You know, it's like only 7%, I think, of youth sports participants have to wear a mouth guard. The MIAA, the Massachusetts Interscholastic Athletic Association, I think there's only 2 sports, lacrosse and I think football, that they mandate that you have to wear a mouth guard.
And they had basketball for a while and then withdrew it in their infinite wisdom.
Hockey is not.
Really? Yeah, it's not mandatory. I mean, almost all coaches won't let the kids playing hockey out on the
Hockey players want to lose teeth, so they don't care. It looks,
But it's,
makes
I mean,
you-
I wear my mouthpiece, so.
but
You
it's,
play?
Oh, yep, I do. I actually,
but
a
it's,
couple weeks ago, I got hit. It's like the mouth with the mouth got in there.
Because cages
Yeah.
on the helmets are
Yeah.
standard, they think it's, I mean, it's incorrect in our opinion, but they think it's safer to, you know, that it's not.
it's something like 34% of all basketball injuries
Oh, yeah.
are orofacial,
Yeah.
you know, injuries, which could have been prevented by a mouth guard.
And then the House 1964 is an act relative to pupil dental health, an exam before starting school, which I'd like Dr. Beth Becker to address because his committee, his council, during his tenure as chair, was instrumental in having this instituted, so. But basically,
Well, actually,
We've spot there.
we've
Which one is
actually,
tough?
we've actually have it as an issue in Salem, where we've met with the superintendent of schools. You know, you're probably, you know, I don't know whether you're married and have kids or not, but if you're a mother and have a young child, you know that your child, you know, has, you know, a medical exam before he goes to school. They do, you know, spinal scoliosis exam. They do eye and vision exams. It's not as important in some school districts, you know, like where we are, you know, we're in a fluoridated area. But like Worcester, Brockton, Springfield, large cities do not have
Most of the western part of
fluoride.
Massachusetts is naked.
Yeah, well, it's less than 50% of all the, you know, areas in Massachusetts have fluoride. You know, we're like 36th in the nation. But because of that, a lot of these kids come in with a lot of decay. And I'm not just talking about a little cavity on the top of a tooth someplace. They open their mouth and their mouth has black holes, upper and lower. I mean, it's awful. You know, you just can't imagine how bad it is. And, you know, I only know that, like, I'm from Philadelphia originally. When I came up here, you know, Philadelphia is fluoridated. Charlie and I went to school together. We had trouble finding kids with cavities to fulfill our requirements in dental school. That's how, you know, significant it was with fluoride. I came up here and I came to a fairly affluent area, you know, Marblehead, Swampscott, you know, kids were having decay like you can't believe. And it's like, I'm looking at this and thinking, what's the story with this? And then I find out Marblehead and Swampscott are not fluoridated. You know, Salem, fortunately, which is where my practice is, you know, is fluoridated. But I mean, the difference is just phenomenal. But if you don't have an exam going into school like that, and at least begin to help these kids, you know, have parents realize what dental health is and, you know, how bad it can be for a kid to have a toothache. I mean, sometimes in some of these areas, you would see kids that, you know, they're like, you know, they're crying in school and the teacher asks them what's wrong, you know, and the kid won't tell. You know, they just have phenomenal decay. You know, and like I said, out in Worcester, Springfield, areas like that, it's just awful. You know, I mean, it should be a state mandate for fluoride.
I mean, it's also true that, you know, you need to get vaccinations, you need to have physicals before sports, before school starts, and so they just want dental exams as well.
Yeah.
Because it's, you know, the whole thing is dental health equals overall health, it's all connected.
and if you surveyed your colleagues and even the legislators, I bet you most of them think it probably is required already, and it's not. and so it really.
Yeah, and the other thing is like, in Lynn, Lynn has fluoride as well, because it's all part of the what's the?
MWRA.
NWRA, the water system. So Lynn doesn't have the same problem, but it's like it's maybe less pressing for our areas, but it's very pressing for the other 50% of the state that's not fluoridated.
This is a bill, it basically boils down to, it's mandated, so it's kind of bogged down because there's, right now, there's a moratorium on any kind of mandated legislation, right? So, the mandated benefit legislation. This is something basically is to cover dental anesthesia for children who are special needs and all those kids that for whatever reason need to have general anesthesia to have their dental work done.
Down syndrome, autism, all these are,
So-
areas that, the kids are just about like,
And it's obviously, there's obviously a need for it, there's a direct benefit to the public for it. Unfortunately, right now, because there is a, hold on all that type of legislation, we're not gonna spend a lot of time with browbeating you about that. This one, the House.
Well, what happens is the medical insurers will not pay for it because they decide it's not medically necessary treatment. Whereas in fact, the kid gets doesn't get the care he needs to be sedated because he really needs to be sedated for their care. I mean, some of these kids are violent, literally. You get in a dental chair, an autistic kid, I worked with autistic kids before I went to dental school. And I mean, they just are, strike out, and it's just nothing you can do. So, these kids, they get a tooth that starts to decay because their mother can't help them brush, and they go to the dentist. He can't treat it. It gets abscess. They get an infection. I mean, there's a kid down in Maryland that died from a dental infection. Diamante, what was the kid's? Diamante Driver, was it?
Driver.
Yeah, died down in Maryland 2 years ago, I think it was, from a dental infection because he didn't get care. So that's why this bill is so important, that it really puts the onus on somebody, the dental insurer or the medical insurer, to pay for the anesthesia. That's really a part, they bring somebody, a general anesthetist in to do the anesthesia. So that's apart from the dental treatment. So they pay for the dental treatment, but meanwhile, who's going to pay for it? So they don't get it done because they can't afford it. These poor people, have more of a burden than you can possibly imagine,
The next one is House 982 and Senate 423, an act relative to increasing choice for dental patients. And this basically has to do with assignment of benefits for the dental benefits for patients when patients see an out-of-network dentist. The way a lot of the companies have it now is that the only way the dentist can safeguard whether their fee is covered or not is demand payment of the patient up front and then have the patient wait to be reimbursed from the insurance company, rather than the patient being able to sign on an assignment of benefits so that that money is sent directly to the dentist and the dentist has assurance that they'll get that check. In today's world, a lot of times patients can sign that statement, but then the check goes to the patient anyway, and so the dentist is left having provided care, won't be reimbursed from it, and the patient has received care and also had a nice little check in their pocket to walk away with.
But it's
Stephen,
confusing, it's confusing to the patient, that's the bottom line.
Do you know what out-of-network, when we use the words in-network, out-of-network, what that actually involves?
I mean, could you just explain that a little further?
Yes, so
Into a dental insurance company, then you're in network,
Okay.
okay? If you exist outside the network, you don't sign the contract, but if the patient chooses to come to you for care, you treat them anyway. And if the patient says, well, geez, I've been going to, Dr. Sylvia's for 30 years, just because my employer decided to get MetLife instead of, Delta Dental, I'm not gonna change. It's gonna cost me 5% more, but what the heck, I'm gonna go and keep seeing Dr. Sylvia's. But now the dental insurance company says, well, you can see Dr. Sylvia's, but we're not gonna send him a check directly. Now, all these years he's been dealing with Delta Dental, Charlie treats the patient, sends, bills the patient for his half, sends the bill to Delta Dental for the other half. So, patient only is responsible for what they're responsible for. With some companies, if you're an out-of-network provider, the patient has to pay in full and then they have to collect from the insurance company. You know, it does a lot of things. One of the things, you know, allows them to maintain their cash flow for longer, because for all intents and purposes, we can, once we bill them directly, they have to pay us within 30 days. They don't have that same onus of responsibility with the patient. And sometimes the patient, you know, is like, well, how come you haven't, you know, sent the, you know, how come my insurance company hasn't paid? We can't tell them a whole lot if we're not an in-network provider, and we have that, if we don't have that ability to bill directly, because we, for all intents and purposes, don't have a contractual relationship with them, which in fact you get if they can assign benefits to the dentist. Then we can literally go to bat for the patient and find out why the insurance company's not paying. Otherwise, all we can say is, well, because we're out of network, you have to do that yourself. The patient gets upset about it. The insurance company maintains their, you know, flow, which they, you know, on a daily basis, they invest in money producing, you know, vehicles, and, you know, so they can, you know, it works for them because they make more money.
Insurance companies are trying to, dentistry, to become in-network. It lowers their reimbursement costs. They pay less money, they have more money. And the power that they're trying to exert to have more dentists become in-service providers, in-network providers, is that basically that reason. But it takes away your choice. If you've been going to Charlie your whole life, you love Charlie, and it makes it very hard for you to go to Charlie now because of that, what was just explained about, you might not go to Charlie anymore. It doesn't mean you're happy. You love this guy, you trust him, and the power, it's a power struggle between an insurance company and freedom of choice for the patient and for us. We don't all sign up for every one of these plans because we have to, it's a very hard thing to work in. It's another place where the pressure on our overhead becomes harder and stronger. So all this really allows is a patient to say, look, I'm going to continue to go to Dr. Silvius. Dr. Silvius will get benefit right away. I don't have to worry about that. It comes out in the wash, and the patient will be aware that out of pocket, there'll be a little higher cost to them to stay with Dr. Silvius if he's not a provider. That's their choice. But at least make the playing field fair, that it works the same way.
Facilitate the,
And they have too much power to sometimes control it, and it's not fair to the patient in general.
And then the last item is House 983 and Senate 424, which is an act to limit retroactive denials of dental insurance claims. And basically, this boils down to, we can expand on what we've been speaking to you about, that a patient has seen Dr. Fisher, they've paid for their copay, what the insurance didn't cover. He's received a check from the insurance company for the amount that they said that they were going to pay. And now 5 years down the road, their bean counters are going through their books and saying, hey, gee, Charlie Silvius wasn't covered under our dental benefit back then, and so they call Dr. Fisher and say that check for $126.85, we want our money back.
well,
And so, now in the meantime, I've moved to Lower Slobovia. He has no way then to get what I should have been responsible to pay at that point, and so he's out the money. And it's not just a simple matter of saying that he's not going to pay the money to the insurance company, because if he doesn't pay it to the insurance company, under his contract, what they'll do is just delete that from a future payment on some other patient, so they're going to get their money back. And even the IRS has limits on how far back they can come and get us for taxes, and that's basically all we're asking is some limitation on a time frame that the dental insurance can come after a dentist and say, you have to give us back money that through our error,
Right.
we paid to you. That's
The
the important
insurance
thing.
companies
We're
error.
not talking about
No
Dr.
fraud,
Fisher
no
having
nothing.
billed them fraudulently.
Right.
We're talking about some legitimate procedure that they've now decided, because some of the internal bookkeeping on their part, they erred, and now they want the money back.
you know, it's like I had a patient who came to me, you know, on a so-called emergency. And, you know, the emergency was he had a boat docked in Salem. When he was pulling his mooring, his denture popped out of his mouth, fell into the ocean, and that's gone. So he doesn't feel he can go to work Monday morning because he doesn't have any teeth. I see the patient on a referral from, you know, one of my patients. We literally make him a denture in 3 days, okay? So the insurance company pays me, their part and he pays his part. I don't even know the guy. He lives down in Wellesley someplace, all right? So all of a sudden, 12 months go by and I get a note from the insurance company, they want the money back because the denture had been made previously in less than 5 years, and they only cover a denture every 5 years. So it's only been 3 years since he had his last denture made, so they don't cover it. So they want me to pay the $500 back. So then I get involved with the patient and say, you owe me the $500. He says, forget it. At this point, he doesn't, it's 12 months later. He doesn't care that I came, that I brought him in on a Monday and had a denture for him by Wednesday so he could go back to work. All he cares about is he's not going to pay the $500 because, he's happy with the denture. Forget about it. Too bad. Call my insurance company, complain to them. If I want to take the guy to small claims court, I have to go back down to someplace in Wellesley, to get him to pay the $500. Now the insurance company, I don't even have to send them the money back. The next time they make a payment to me, they take the $500 out of the check that they're paying me for other patients that I'm seeing.
So there's no negotiation, they just,
Yeah, there's no
They're
negotiation.
gonna do what
they're just taking it.
Yeah.
We're taking it and then
And so
you
they
worry
say,
about it.
well, that's,
And
that's the way it is.
unlimited
You have
amount
to
of
collect
time?
from the patient.
Is it literally unlimited?
Yeah,
or-
now it's, pretty much, and that's.
Now
and
I
so-
can say to the insurance company, well, you can't get it from me because, your contract is with the insured. You want your $500 back? Go to the insured. Well, I don't have any recourse once they take that $500 out of my payment for dentistry that I've completed on other patients. All I can say is the insurance company, wait a second, that's my $500. What are you doing taking money that you owe me for these other patients? Well, that's because we didn't cover it for this patient. So I can go to court and sue the insurance company, how far that's gonna go. So,
But it's an important aspect. You're here listening to this story for the first time. Your basic sense of fairness tells you that doesn't
Yeah.
sound right. But it happens all the time. There's none of us here that doesn't happen to us at least several times a year. And sometimes it can be even worse case scenario, much farther, longer ago, and a patient that simply moved. You have no way, forget even knowing where they are at this point in time.
well, that's
You
the same
can't
thing
even
in
contact them.
my case. It was well after, 12 months, it was like, and I think at that point, he was having because he gets one every 5 years, and somewhere he found out he gets one every 5 years, and they paid for the,
But we
the guy
could be
besides
talking
his-
timelines of not months, but years.
Yeah.
The
And
bottom
that's the
line
tough
is
part.
that it
We're trying
happens
to,
all the time. What we're asking is just do the right thing. Nothing more, nothing less. And we don't see that as often as we think we
but
should.
that's what the bill says. Basically, the bill stipulates that benefit companies can, they do it like further down the line, unless they give us something in writing, and they can't do it, and no more than 12 months, time has elapsed. So we're just trying to limit it, to 12 months, which doesn't seem like an unreasonable time to figure out that they made a mistake.
So we hit you with 100 things. What can we answer for you that popped up in your head right now?
The fact that it's swimming with,
So many facts and stories. I'm just trying to digest everything.
our biggest question is, how concise and clear were we for you to come away with something that,
Oh, I thought you were very clear and
Okay.
definitely explaining it, and obviously the personal stories definitely filled in some of the details. So I feel like I got a good grasp on the bills that you're trying to push, and I can definitely pass them along to the center. I know he's been supportive of a number of these in the past, and obviously I'll talk to Megan, and she can help fill me in on the
Oh,
other
those guys
details.
were back?
Oh, plus, we're happy to talk to you anytime. I'll give you my card too.
Yeah, absolutely. I can
My-
Do you
definitely-
have cards, Steve?
Yep,
yeah,
absolutely.
that's what I want.
Pass them
I'm
around.
sure I'll have further
My
questions once I.
My office is actually over in Salem.
Thanks, Tom. And that's the thing about
I live in Marblehead.
Oh, okay.
the mass health.
Thank you.
Actually, since can I have two, one that I can write my stuff and give it back to
Take
you?
two, they're small.
I think I have one in the office.
Where are you from, Steve?
I am from Lynn.
Oh, you're from our neighborhood,
Yep,
okay.
I actually, Senator Mcgee, I walk outside my front door and I'm looking at his back door, so he's the street right across.
We've always wanted to know where you live. No.
I can tell you. No. Nope, he's a Lynn guy.
I saw him and Steve Welsh at John Keenan's
Oh, at the
St. Patrick's
breakfast?
Day party.
Yep.
I didn't see you there, Steve. You didn't make that.
Actually, I went to Finn's the first time this weekend.
Oh, great.
First time.
So you'll come to the St. Patrick's Day?
I will be there next year.
I think he's not gonna have it.
Yeah, he's not sponsoring it. Yep, I heard that.
Just sort of too bad.
I know.
It's been a fun thing.
I heard it's been really.
Steve Walsh used to
It's
say.
all right.
at
Oh,
the
really?
race. He didn't do it this year, but for years he would say.
He's probably tired with the kids.
Give you my card.
Oh, sure.
This is our office. It's too fast.
These young guys, what are we gonna do?
Steve.
You know, the tough part is for us, I mean, you might notice you have a,
Give him that-
you know,
that
number
first
older,
truck.
and they understand the issues more than some of the younger guys
Mm-hmm.
who really are being taken advantage of by, you know, the insurance companies. Because they just assume that everybody signs every contract. And they're the ones who most don't read the things. And then, you know, find out that what they're into. You know, I mean, I have one young lad that I sort of mentored a little bit, you know, and you know, he was telling me about this plan that he signed. It's great. You know, he decided he needs to get a few more days in. His kids were getting a little bit older. They were going to school, but send them to private school. So he said, you know, they're sending me so many new patients. I can't believe it. You know, and then a year goes by and he calls me and he says, you know, Fish, he says, do not ever sign up for this plan. He said, I worked 5.5 days a week this year. Before that, I was working 3.5, 4 days. He said, I didn't make as much money as I did when I was working 3.5 days a week. You know, I just had a meeting with my accountant, and I'm like, well, you know, when something sounds like it's too good to be true, it probably is too good to be true. But, you know, that's the shame of it. You know, we don't have any business courses in dental school. You know, I mean, if you don't pick it up somehow or have a parent who was in business for themselves. I mean, I was practicing for probably 3 years before I knew I had to carry workman's comp. You know, I mean, there's nothing. They don't send you a packet when you start a small business in Massachusetts. And you know, I saved the money for not having workman's comp for 3 years, and I still don't understand why you have to have workman's compensation in a dental office. But you know, you have to have workman's compensation. But there's so many things you just have no clue about. You know, as a young dentist starting out, you're sort of opening practice and hoping for the best. You know.
Absolutely. Thank you for coming in. It's definitely an eye-opening for me, a learning experience. So I'm definitely gonna look into all of these and definitely pass along.
Give our best to Megan and the center.
I will.